My name is Dr. Kiran Rabheru of the International Longevity Center of Canada and the International Psychogeriatric Association. There is no health without mental health. These are both indispensable human rights and prerequisite to living one's life with dignity. Unfortunately, mental health systems have been in crisis, with burden of mental illness being among the 10 leading healthcare-related issues globally. No measurable reduction in this has been seen for over 30 years. At the same time, the demographic clock continues to tick. Today's 703 million people over age 65 are projected to reach 1.5 billion by the year 2050. 20% of them will suffer from serious mental conditions. At the heart of this global crisis for older people is ageism, frequently intersecting with ableism, mentalism, sexism, and racism. These biases result in violations of older people's human rights, with the resulting poor quality of life and premature death. They're compounded by major gaps in legislation, policies, and practices, rendering the central transformative promise of the UN's 2030 agenda to leave no one behind a very elusive goal. Evidence-based interventions that are designed to prevent or to reduce the risk of common mental health conditions, as well as disability, are already available. All governments and policymakers have a big role to play in the promotion of good mental health and prevention of mental illness by integrating them into the public health and general social policy. This requires adopting, implementing, and scaling up of cost-effective interventions to reduce the risk of developing mental disorders and by providing access to adequate treatment when needed for older people. All governments and policymakers have a pivotal role to play in leading and supporting a United Nations Convention on the Human Rights of Older People. A convention would help combat ageism at the national and international level by ensuring integration of monitoring and enforcement mechanisms to effectively implement policy and laws that could address discrimination, inequality, and protection of human rights of older people, including their mental health. Thank you.